Public health serves a large composite population. The population is made up of communities with differing values and cultures. Naturally, these communities have conflicting ideas about what should be done or not done to assure the public's health and how to go about achieving the best overall results at acceptable cost without disrespecting or inconveniencing individuals. Politics is the process of listening, considering, negotiating, and finally, determining priorities. What groups, diseases, conditions, and research causes will receive money and resources and how much. What's empowering about politics is that it begins at the grassroots. One can advocate for public health cause at school, workplace, or town board. One can write letters or pay visits to state legislators or members of Congress. One can even build coalitions or join existing lobbying efforts. What people feel is morally right, however, may not be politically feasible. For example, there are groups that object to Obamacare, ACA, the Affordable Care Act, and actively lobby for its replacement by a single-payer system of health care. They complain of too much administrative waste with multiple insurance companies and complex billing procedures, and they recommend that the federal Medicaid insurance program underwrite all U.S. health insurance. With the savings due to efficiency and an added sales tax, the government could actually achieve universal health care coverage. No one would need to purchase a private policy, and there would be no need for employer-sponsored health insurance. Though the single-payer system works in Canada and in parts of Europe, it may not be politically feasible in the U.S. Our ideology of strong individualism, the political and economic power of our insurance and pharmaceutical industries, and our long history of opposing socialist practices may prove to be an insurmountable barrier. Nevertheless, it is a positive feature of our democracy that we can have such a public policy debate. Although we hope and trust our elected officials will carry out policies that represent our best interests, the system is always vulnerable to abuse. While in any public policy debate involving public health, it's essential to use scientific evidence to support an argument. Scientific evidence is sometimes suppressed or misrepresented to fit a political agenda. The administration of George W. Bush put pressure on the Centers for Disease Control and Prevention to support abstinence-only programs for curbing teen pregnancy, when evidence showed abstinence-only programs to be ineffective. Furthermore, it pressured the CDC to replace information on the effectiveness of condoms in preventing the spread of HIV/AIDS in favor of information emphasizing condom failure rate, and once again to claim the effectiveness of abstinence-only programs. Due to the weight of statistical evidence, government oversight, and monitoring, abstinence-only programs are no longer federally supported. They have been replaced by proven comprehensive sexual education programs that acknowledge prevalence of sexual activity among teens today. Comprehensive sexual education programs aim to give teens the information and tools they need to be healthy and safe. While organizations and community groups participate in the political process, it is the government at the federal, state, and local levels that has the authority to establish law, set regulations, and appropriate funds for the public's health. For example, at the federal legislative level, in 2010, Congress passed the Affordable Care Act. In 1965, Congress passed the Civil Rights Act, which encompasses many social justice aspects of public health. If an individual or group perceives it has been harmed by government and the law, it can seek relief, remedy, and sometimes compensation by bringing litigation in the courts. This constitutes case law. At the federal judicial level, in Roe v. Wade, 1973, one of the most far-reaching yet still contested U.S. Supreme Court decisions, it was decided that a Texas law banning abortions was unconstitutional because it deprived Roe of her inalienable rights of liberty and privacy. In Brown versus the Board of Education in 1954, the U.S. Supreme Court ruled that public schools must be desegregated and that separate schools were inherently unequal and unjust. Standards of social justice had to be met. The executive branch takes legal decisions from both the legislative and judicial branches and directs its agencies to work out details. Examples of federal public health agencies are the Food and Drug Administration, which regulates and supervises food safety, pharmaceuticals, tobacco products, vaccines, cosmetics, etc. Centers for Disease Control, which looks for patterns of disease outbreaks, controls disease, and prevents its occurrence. And the National Institutes of Health, which conducts health research. And Substance Abuse and Mental Health Services Administration, which prevents, treats, and provides rehabilitative services related to substance abuse and mental illness. Examples of New York State public health agencies are the New York State Department of Health, the New York State Office of Alcoholism and Substance Abuse Services, the New York State Department of Environmental Conservation. Examples of local public health agencies are the Albany County Department of Health, Albany County Department of Social Services, and Albany County Department of Child Protective Services. The U.S. Constitution does not mention health. In the preamble, it says that a fundamental purpose of government is to promote the general welfare, and it gives the federal government the authority to regulate interstate commerce and collect taxes. That terse statement is the basis for the federal government's role in public health. To clarify, the 10th Amendment says that the states may claim any powers not specifically assigned to the federal government. The states, therefore, have the lion's share of responsibility for public health. All of the states collect data about their populations, immunize school children, and regulate environment and safety. Yet there is a considerable variation among states on everything from abortion rights to gay rights to fracking and marijuana legalization. The national public health agenda is constantly expanding. In 2010, the federal government increased its public health role by passing and implementing the Affordable Care Act. The Affordable Care Act's explicit purpose is to extend health care access and coverage to millions of uninsured and underinsured Americans. In recent decades, not only health care, but substance abuse, mental health, long-term care, violence, and terrorism have been added to the national agenda, providing government, non-governmental agencies, professional membership organizations, and philanthropies with additional public health challenges and responsibilities. It's clear by the breadth of these challenges that government cannot go it alone.